CPR, and Patrick was right there by the bedside, and this went on for like 6 or 7 hours, and it just seemed like minutes.
I mean, she crashed a handful of times right there in front of us. We're like, just one more time, come back, come back. We had to bring her back. And then finally, when they did call Wolfson, it was a game changer.
Hold on to me, and I'll hold on to you. As long as we are together, there's nothing we can't do.
We're the only children's hospital of a comprehensive nature that exists between Orlando and Atlanta. So when people come to us, there's a higher responsibility.
And we're able to offer some life support mechanisms that aren't always available at every hospital, and so this is considered the highest level NICU that there can be.
We get the sickest of the sickest babies regionally. Because of the outreach and the growth and the need that this community has had, we've outgrown our current area.
We can't say, well, I'm sorry, we don't have a critical care bed right now. You can't send that patient.
There's no preparation to become a NICU mom or NICU dad. There's no textbook that anyone can write to help us navigate through the last 4.5 months.
So stay close to me.
When the twins were born, they were 31 centimeters.
£1.5 pounds each. It was tough to handle having one child still fighting on one side and losing another.
Some things that I can do without, but something's not you.
You know, we'd rather have stayed there with our baby all night for sure.
I think one of the hardest things for families probably is that being separated from their baby.
Research has shown us over time that privacy areas, even for our smallest patients, really help the developmental growth of these babies. The new concept of having all private suites helps to aid in that development.
So the new unit, it's got treatment rooms built into it. It is a full family-centric space where the mom and dad can both sleep in the room. If you think about this facility, don't think of it as a building. Think about it as a place of cure, a place of life, a place where we can keep a family whole.
They have been here to support us. 100%. They're not just here for her, but for us as well. They realize that my strength is important for her.
All I see, and all that I did, could never come close to the feeling that I get from you.
From Tallahassee to Jacksonville, they mediflagged her and we drove. And once she got here, the team here was in place and ready to go to work. And they were calling us in our vehicle as we were traveling on Interstate 10. So we've known since that drive over
that we
were in the right place.
We have an amazing need for our children here in this community, and unfortunately with healthcare, all of our costs are never covered. And so it's very important that we've identified this tremendous need in the community to care for these very little vulnerable babies.
My husband and I decided to get involved in Dream Starter, where you make an annual commitment to donate because our babies are saved because the hospital was there.
There's a calling there. This is just absolutely unbelievable. So we're fortunate that we actually can get involved and try to make a little bit of a difference.
I can't believe that your love has come to me. If ever I hold on to, gonna hold on to you. Gonna hold on to you. Oh, never gonna let you go.
this is just what they do. They just save lives.
At the end of the day, that's what we're in the business of. We're saving children's lives.